The English version is named as From Lockdown to Freedom.
Hello lovely people, and welcome back to Anita's Grill. On this channel, I share my experiences as an international student, and I also encourage others to share their experiences and lend their voices. And today we have a very important guest with us, Dr. Damika. You're highly welcome, and in all sincerity, it's a privilege to have you here today. You're welcome, sir.
Hello Anita, thank you very much for inviting me, first of all.
You're highly welcome again. And I know our audience, and I know they are very keen on knowing who you are and the experiences you have to share with us today. Would you mind telling us a bit about yourself?
Yeah, of course Anita. I am a medical doctor from Sri Lanka. Almost around 19 years of experience in clinical as well as non-clinical areas in the National Healthcare Service of Sri Lanka. So under the Ministry of Health of Sri Lanka, I was in the front line of COVID-19. So I was leading my team of more than 30 people towards the control and preventing people getting COVID. So during the COVID period, with my experience, many people have suggested me to come up with some writing with my experience. So just to share my knowledge and experience with the public. So I thought of writing a book, right? So there is a saying that every person will be completed when you write a book. So I have done that in my life.
Congratulations.
So, thank you. So I did it in my native language Sinhala as well as in English. The English version is named as From Lockdown to Freedom. So I am happy and proud to say that the book is available in London British Library as well as in our Coventry Mother Library and in Coventry Medical Library in Hudson's. So I am really happy, and I would like to thank the librarians of all those three libraries for accepting that. So that is a real knowledge sharing, because it's not a novel or story, but it's a case study where we how we manage the COVID, how we manage the lockdown, what are the obstacles we faced as a team. So it was really a bad time because we were working around the clock. So everything is there. So you can refer that and see later. So
if you're here to subscribe to our channel, please do also subscribe, hit the notification bell so you get notified whenever we post a video. Would you mind telling us why you decided to study in England?
Yeah, because actually when I was working as the healthcare administrator in the middle level during this last 9 years, so I understood that rather than being in the clinical sector, I can do much more things to prevent people getting sick. So that is very important, preventive sector, so public health sector. So where I worked. So then there I have followed 2 masters, including one from same healthcare health sector management from Cardiff Metropolitan University, London, UK. So but still I thought of having a real experience following a full-time MBA. So that is why I thought of coming to Coventry. So especially when I inquired, I got to know that it's a very reputed university. So because of that, I have selected this MBA in Health Sector Management and Leadership course, as well as far as it's a full-time course.
Very nice and interesting as well. So in general, what has your experience been as an international student? What are the challenges? Because we know it's not always right. So what has your experience been like so far?
Yeah, actually I think for any student coming to UK, is the main challenge is the cost of living. It's very high here, especially in London. So that is a big challenge, of course. And finding accommodation is another challenge. So in that sense, I was lucky enough because I had one of my brother's friend's elder brother who is living here for more than 20 years.
Okay.
So he helped me to find another Sri Lankan family. So I was lucky enough to have another Sri Lankan family where I live now, near Edmonton Green. So they are in that family. I am also like, they treat me like a family member. So I live with that family in a separate room. So and they are sharing their food even with me. So I'm really lucky and comfortable living with them. So and my friend who found the place, also they are inviting me weekly and they are feeding me all the time. So I'm really lucky in that sense. But I think most of the students are struggling with living here, finding a better living place for a low cost. It's really a big challenge.
Okay.
So those are the main challenges, I suppose. So, and the traveling, transportation is very high costly here. And in that sense also I am lucky because from there I can come to the university by one bus.
Okay.
So that is a big privilege because here if you come by underground tube, it is the cost is doubled.
Yeah.
So and the other thing, so through that friend even, and I was introduced to a GP practice.
Wow.
So where I work now, so they are also a very wonderful, nice team. So I am really thankful to them because they are really treating me very well there. So I am working as a healthcare admin, one of the healthcare admin staff in a GP practice called Alexandra Surgery. So they are really helpful, and there I did my final internship consulting project as well. So I'm really thankful to that administration, especially the main consulting GP there, as well as the managers, financial manager and the practice manager, and the whole team. They gave me a big full support because I did my internship on NHS e-referral system. So the pros and cons, what are the issues, and so and I'm happy to tell that 2 days back I got a distinction.
Oh, congratulations! 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 In academics, I know you said that you've done 2 masters prior to this. So, is there any difference or any challenges with regards to communication, assignments, mode of teaching?
Yeah, it's a very good question, Anita, because the thing is, I have seen a big difference because in a positive side, because the thing is, in our country, even though I have gone through those 2 masters, we got used to some sort of a spoon feeding.
Okay.
Right, in our country setting, because even though adult learning, it should not be a spoon feeding, but it is still in our countries. They are giving all the materials, lecturers are helping. That means that too much of helping, I think it's not a real help.
Okay.
Right? So because the thing is, when it concern of studies, right? Because adult learning is you have to learn by your own, right? So here they did it in a nice manner, especially in the university. This Olaf platform, right, is really wonderful because all the study material is available from the beginning of the semester. So if you are smart enough, you can go through all the material, additional readings and textbooks, right? Suggested textbooks and compulsory textbooks are there. So if you go through all, even they are sending too much of this video recordings, right? So much, even it is very hardly you can cover it, but still if you are smart enough. So actually I could do it in a nice manner with our friends in the class. So we have some discussions, right? It's very productive way of studies. So and here they in the assignments they allow us to apply what we learned.
Okay.
So it's really nice. At the end of the semester, you have, in the first semester we had 4 modules. In the second semester we had 4 modules again, and the final semester it is the internship consulting project. So each after each semester you have to submit on time. There are no excuses, right? So you have to submit it on time. So if you start at the very beginning with the starting of the first week, then of course you are at the end of 9th 10th week, like, so you are ready with your module even assignment.
Yes.
So then it's a very nice way of teaching. So I'm really inspired with that, and we had a very nice set of lecturers, and we had a nice teamwork, group sessions, that means discussions, so interactive sessions. So it's really nice.
Okay, thank you so much for sharing that with us, Dammika. That was really, really insightful and interesting. In your class, what was the age difference like? Did it affect you in any way? Did it have an impact on you?
Yeah, because the thing is, I was the oldest, right, among all. But the thing is, even they didn't guess my age. I think so.
Okay.
And especially because I was really active in the class, and they also shared my knowledge. Even the lecturers always tried to share my knowledge, because they always highlighted that they are privileged to have a experienced student like me. So I'm really happy and thankful to them. I'm proud of that.
So Dammika, what advice do you have for other students that are intending to come and study or go for higher degree? What advice do you have for them?
Yeah, I think the main thing is the teaching pattern, the learning environment is really good here.
Okay.
So they can definitely, I would recommend the university and this course actually to people who, because there's no matter, because what I see in UK, they don't care what the field you are, right? Once you are happy to have a degree, if you are capable enough learning it, then of course that is up to you. I think it's a good trend, that because the thing is, rather than labeling you are a medical doctor, only medical doctors can do this, or only medical people can do this, because this is healthcare management and leadership.
Yeah.
So that is more or less administration, right? Management. So any managerial person can do it, because healthcare management is also a sort of management. So because of that, I think people can from other areas also can get this experience because leadership is the bread and butter of everyone.
Yeah.
Because good leaders will lead any organization.
Yeah. Thank you so much, Dammika, for sharing this with us. This is really a privilege, because for someone like you who has lots and lots of experiences and sharing it with other people, you may just be encouraging someone out there. You did a very good job by sharing your story with us, and we really, really appreciate that. And I know our audience out there are so happy to have listened to your story. So if you're here to subscribe to our channel, please do also subscribe, hit the notification bell so you get notified whenever we post a video. Thank you so much, Doc, for coming and doing this with us today. We really appreciate it.
Okay, thank you
Bye-bye.
very much for inviting.